rock, most people enjoy a good story. Imagine a story where you rock. I challenge you to make a difference in the world and then share your story to inspire, bring hope, and encouragement to others. Together, let us create a better, more peaceful world. Let's not just imagine world peace, let's work for it. Are you doing something rocking in Saskatoon, Saskatchewan, Canada, or the world? I would love to have you on my show to share your rocking stories. We're here with Simon Lasair with the Canadian Association for Spiritual Care. Welcome.
Thank you.
So what is the Canadian Association for Spiritual Care?
Well, the Canadian Association for Spiritual Care is the professional organization that trains and oversees the work of chaplains or spiritual care practitioners across Canada. And we have a special interest in what's been going on here in Saskatchewan. I'm a member of the Canadian Association for Spiritual Care Saskatchewan Executive. And just given the cuts that occurred to spiritual care in Saskatchewan, we've been very crucial in crafting a response to those cuts.
And what kind of cuts were there?
Well, previously in the hospitals in Saskatchewan, there were spiritual care practitioners who would care for patients and their families, as well as in some long-term care facilities. And in its 2017 budget, the provincial government announced cuts to all the spiritual care programs in publicly owned and operated hospitals and other healthcare facilities in the province.
So that's all across Saskatchewan and all the hospitals?
All across Saskatchewan. Mainly in hospitals, but also in some long-term care facilities as well.
So why is it so important to have spiritual care in a hospital?
Well, especially in a hospital, patients often come to hospital after having some major crisis, and those crises can be very devastating for them. Say, a person goes to hospital and discovers all of a sudden that they have cancer, or they've been through a very serious motor vehicle accident, and often in those kinds of situations, patients are wondering, well, how do I make sense of this? How do I integrate this huge news into my life? Mm-hmm. And spiritual care practitioners are there to listen, to accompany people as they're trying to process that. And spiritual care practitioners have special tools at their disposal to help people to integrate these big major life events into their overall life's narrative.
Mm-hmm. So how does it work? How does the spiritual care work? Do you sign up for it, or it just happens in the hospitals? Or
previously we were employed by the health regions.
Okay.
So they funded our work. My colleagues, there's still some people who are employed by specific religious denominations to provide care to their own people. But the biggest gap that's been opened up is that the departments of spiritual care in the health regions previously cared for people with no religious affiliation. Okay. And so now there are significant numbers of people, upwards of 50% on any given day in the hospitals, who just won't receive any care in this way.
Mm-hmm. And why is it so important to have this spiritual care?
Well, because as people are processing their very complicated feelings in light of devastating medical news, often they just need someone to talk to. Mm-hmm. Social workers do have some tools like what we have, but they often don't have the time to just sit down and listen to people. Spiritual care practitioners do have that time to listen, to hear the stories of the people who have gone through these various events, and to offer counsel in terms of spiritual insight as well, if that's where the people want to go. We also provide prayer, some religious services, and then the departments of spiritual care would also connect people with their own clergy if that was what the patients wanted.
So what was your role?
What was my role?
Yes.
Well, I worked in spiritual care in the hospitals, and I would provide some care to people there, and it was very fulfilling work. It was work that gave me a lot of meaning, but I know the value of that work for the patients as well, because often the patients just needed a place to let it all go, you know. They wanted to express their feelings. They wanted someone to pray with, and so for the patients, this is a big loss.
So it's dealing with the whole person.
Exactly. I mean, the many healthcare professions are trained to deal with the body, with the mind, but there are no professions in healthcare that are trained to specifically deal with the spirit. Spiritual care practitioners were the only people in healthcare specifically trained to deal with the spirit. And so now that component of healthcare is no longer available to people in publicly owned and operated facilities, the ideal of holistic, whole person, patient-centered care that the health regions and the government says is so crucial, there's going to be a bit of a gap there.
Well, I'm sorry to hear that happened. And I know it's so important that people have care in all areas. And so what has your experience been on the positive end of spiritual care? What kinds of experiences have you had?
In terms of myself receiving spiritual care?
Or with the patients?
Well, I mean, often patients, in light of devastating news, as I said, they just need someone to hear them out. And so often what that involves is just sitting down, having a conversation. How have things been going for you? And then they will tell their story. And as they tell their story, what I try to do is, in my own practice, is I try to draw attention to the emotional and the spiritual sides of their stories. Mainly because often that doesn't happen with the other healthcare professions. They want the facts, they want to hear what a person is experiencing physically or emotionally, but not necessarily at that spiritual level of where they make sense of their lives. And so as I've done that, I've had patients say to me, wow, that was amazing, just simply to have that conversation with you, to consider some of the bigger questions, to help me see this in a larger perspective. Because now, even though this whole situation is terrible, it's really unpleasant, now I can keep going forward, and I can navigate my way through this very difficult experience because I've been able to tell you my story.
And you giving them the opportunity and the time is so important.
Exactly, because in the hospitals, all the staff are very busy. They provide excellent care, but they are so busy. They have so many patients to see that often there is an opportunity for longer engagements with the patients. So to have someone who takes the time to listen to them thoroughly, to be empathetic, to hear all those things, it's a really wonderful opportunity for the patients. And it's a very sad day when that has come to an end, because we're no longer offering the patients the care that they need, that they deserve.
Thank you very much for being on our show and sharing about spiritual care. We'll be right back.